Thank you so much for joining us today. As you know from the media release we sent out, over 15,000 physicians across the country have signed a letter calling on the Senate to reject Robert F. Kennedy Jr.'s appointment to be the Secretary of Health and Human Services. And in Maine alone, 150 physicians have signed this letter. Three of the signing physicians have joined us today to share their concerns about Mr. Kennedy and urge Maine's Senator Susan Collins to reject his appointment. I'd like to note that the full list of signatures is not being shared publicly with press, just out of concern for privacy of those physicians. If you have questions about that or the letter, please follow up with me after the call. I'd also like to note that physicians speaking today are speaking as individuals and with the Committee to Protect Healthcare, not necessarily on behalf of any employers. So we please respectfully ask that you only refer to them in any coverage as they introduce themselves today on this call. So thank you in advance for being respectful of that. Without further ado, I will introduce our first speaker, Dr. Naliboff.
Thank you, Annika. I'm Jay Naliboff, a retired OBGYN. I practiced at Franklin Memorial Hospital in Farmington for 35 years. As physicians who have served our communities in Maine for many years, we took an oath to do everything in our power to keep our patients safe and healthy and to keep them from harm. And this includes speaking up when we see looming threats to their health and safety. As nominee for Secretary of the Department of Health and Human Services, Robert F. Kennedy Jr. represents a clear danger to the health and safety of Mainers and to every American. RFK Jr.'s opposition to vaccines and his active role in spreading disinformation about vaccines endangers the lives of people, especially children, pregnant people, people with weakened immune systems, and older Americans. As a candidate for the top federal official responsible for health policy, RFK Jr.'s active opposition to one of the most effective methods of protecting people from preventable diseases, including deadly diseases with no known cures, should disqualify him from leading HHS. Doctors in Maine and across our nation are speaking up in opposition to RFK Jr.'s nomination and calling on the U.S. Senate to reject Mr. Kennedy as HHS Secretary, because Mainers and Americans deserve someone who will fight to protect people from preventable diseases and not open the door to more infections. That's why, as Annika said, more than 15,000 doctors across America and 150 across Maine signed a letter calling on senators, including Maine Senator Susan Collins, to oppose RFK Jr.'s nomination. RFK Jr. has no expertise in healthcare and no experience managing a large, complex organization such as Health and Human Services. He is the founder of Children's Health Defense, a nonprofit that spreads anti-vaccine disinformation and which even sued to stop COVID vaccination at the height of the pandemic. RFK Jr. has claimed with zero evidence that vaccines are tied to autism, despite evidence conveyed through studies over decades that have disproven such a claim. He has compared vaccine requirements to Nazi Germany, ignoring the role that herd immunity plays in protecting at-risk individuals. He did play a role in one of the worst measles outbreaks in recent memory. RFK Jr. exploited the accidental deaths of 2 infants in American Samoa in 2019 who were given vaccines mixed with expired muscle relaxants instead of water, and he flooded the region with disinformation. It should be noted that this was a human error and not a vaccine error. The result, vaccination rates dropped to a dangerously low level, 34%, compared to 99% in a nearby island. Within months, the disease tore through the population, sickening more than 5,700 people and killing 83, most of them young children. RFK Jr. is a danger to our public health and to the personal health and well-being of Mainers. The Constitution tasks senators with advice and consent regarding presidential appointments. Please don't consent to letting this dangerous individual be in charge of our nation's health. Thank you. And now I'd like to invite my colleague, Dr. White, to speak.
Thank you, Dr. Naliboff. As mentioned, I am Dr. Mary White. I'm a retired internist with a subspecialty in infectious diseases, and I live on North Haven Island. One of the reasons I chose to focus on infectious diseases is that my cousin contracted polio at the age of 4, at a time when no vaccine was available. The good fortune that I had to receive the vaccine and that she could not benefit from struck me even as a child. RFK Jr.'s record of spreading dangerous disinformation about life-saving medical interventions, such as vaccines, should raise red flags for every Mainer, including our U.S. Senator Susan Collins. Just recently, we learned that RFK Jr. formally asked the Food and Drug Administration, an agency the Secretary of Health and Human Services would oversee, to revoke the authorization of all COVID vaccines. RFK Jr. wanted to stop COVID vaccines during a deadly phase of the pandemic in 2021, when thousands of Americans were still dying every week. Now we know from analysis and data that in the 5 months between December 2020, when the COVID vaccine was released, and May 2021, those vaccines may have averted 140,000 deaths, saving lives and sparing many families grief and suffering. They were lucky, just as I was when my cousin was not. RFK Jr.'s petition claimed that the COVID vaccines weren't necessary because good treatments were available, including ivermectin and hydroxychloroquine, which scientists had already been deemed ineffective against the virus. We also know that an RFK advisor tried to get the polio vaccine revoked. The polio vaccine, which is safe and effective, has prevented 20 million cases of paralysis in U.S. children and has nearly eradicated the disease. RFK Jr. has also attacked a vaccine that helps protect young people from the human papillomavirus, or HPV. Vaccines against HPV have been shown to nearly completely prevent the most common type of cervical cancer, an achievement once thought impossible. HHS is responsible for keeping Americans safe and healthy using evidence-based science and data-driven information to shape policy and promote best practices, and this includes vaccines. The fundamental message is that vaccines have a long history of successfully protecting people from infectious and dangerous diseases. Vaccines don't just protect us from preventable diseases, they also improve our quality of life. And as vaccine technology advances, researchers and scientists can make better, even safer, and more effective vaccines. For example, my older daughter suffered from many sleepless nights due to the fever and itching of chickenpox. My younger daughter was lucky to have been born at a time when the vaccine was available, and she has been disease-free. Vaccines are also incredibly safe. And before they are eligible for FDA licensing, vaccines are studied in groups of people in even larger numbers than are required for most medications. Once licensed and put to use, multiple layers of safety surveillance continue for as long as those vaccines are distributed. Every scientific authority recommends routine vaccination, including the American Academy of Pediatrics, American Academy of Family Practitioners, American College of Obstetricians and Gynecologists, the American Medical Association, and many, many more. But Mr. Kennedy has no legitimate healthcare background, nor is he medically trained. Our decision as doctors to promote and validate a treatment or intervention is driven by science, evidence, and data, together with compassion for our patients and what they hope is best for their health. We wish for a leader at the Department of Health and Human Services who will join us in supporting evidence-based science and life-saving medicine. RFK Jr. represents none of these goals. Thank you. I'd now like to invite my colleague, Dr. Brendan Press, to speak.
Hello all, and thanks for coming today. My name is Brendan Prest. I'm a family doctor that works in Maine. I'm an advocate, and I'm also speaking on behalf of the Maine Academy of Family Physicians. As doctors, we recommend routine, up-to-date vaccinations because vaccines don't just protect the individual. They also help keep the community safer. For vaccines in primary care, I work both taking care of patients, but also educating our next generation of healthcare professionals. On top of clinical teaching, I have worked on projects across multiple institutions to increase medical education around engaging and addressing medical misinformation. We do not regularly learn this in medical or health profession schools, so I'm doing what I can to teach that next generation of learners how to effectively engage with vaccine misinformation. A major part of that is increasing awareness of the benefits and necessity of vaccines with all of our patients. When more people are vaccinated, we help strengthen the immunity of the group. And this is especially important as we see outbreaks of disease happen all around us. Whooping cough, flu, and other infectious diseases are on the rise. Last week, I had several patients admitted to the hospital with either the COVID or flu at the same time. Several of these patients I had strongly recommended the COVID vaccine or the flu vaccine for, and they declined due to concerns over safety or a lack of trust in vaccines in general. Our neighbor New Hampshire saw its first case of measles a few months ago after keeping it at bay for many years. With communicable infectious diseases that can spread easily, we know unfortunately that what happens in one state doesn't always stay in one state. Vaccines have helped eradicate deadly diseases such as smallpox, considered one of the deadliest diseases known to humans. Because we don't have a cure for smallpox yet, vaccines are the only way to avoid this deadly disease. You've also likely heard about the rise of bird flu across the country. Mr. Kennedy has already pounced on this opportunity to spread more disinformation about scientific research and vaccines. He's jumped online to spread bird flu conspiracy theories and sow doubt about potential vaccines under development to help combat it. When crises like bird flu emerge, we need swift leadership based in evidence, not conspiracy theories. Our communities deserve better, and our children deserve better. Getting children vaccinated keeps them and also those around them safe, from grandparents to loved ones who have weakened immunity or illnesses that expose them to greater risk of health complications. Polio, for example, is one disease we do not want to see back in Maine or anywhere else for that matter. In the 1950s, before widespread vaccinations, polio was still sickening thousands of Americans each year and killing hundreds of them. And many Mainers still remember that horrible disease, including many Mainers who survived polio. As doctors, we care for those polio survivors who continue to struggle with long-term disabilities and chronic conditions. I was hoping I'd never have to see people with newly developed post-polio syndrome, but now I'm worried I will again. We also can't forget that many children used to not make it to adulthood at all. Diseases like whooping cough and measles killed children, not to mention caused immense suffering in many. These diseases are entirely preventable with vaccinations, yet rates for them are dipping. We can't let this situation worsen, and that's exactly what Mr. Kennedy would do. As a spreader of falsehoods with no basis in reality, RFK Jr. is the wrong choice for HHS Secretary. Well over 100 Maine physicians and over 15,000 physicians across the country agree. In fact, members of my own advocacy group, Healthcare Advocates for Maine, have already had a direct conversation with Senator Collins last week about our concerns. Mainers deserve a Health and Human Services Secretary who will stand up for vaccines and promote immunizations, not spread disinformation and diseases in the process. We urge Senator Collins to listen to us and make the right choice for the health of her constituents and all Americans. Thank you.
Thank you so much, Dr. Press, Dr. White, and Dr. Nalaboff. Excuse me. We'll now open it up for questions. If you have a question for one or any of the physicians, kind of the easiest way for me to help facilitate that is if you type your question and your organization, your news organization, in the Q&A or the chat box, and then we can help kind of filter through and make sure that they all get answered. So we'll allow a few moments for folks to be able to type those questions. Not seeing any yet, but I know it can take a minute to type, so we will wait another minute. In the meantime, I also wanted to mention that we are recording this. So if you'd like a copy of the recording, please send me an email where you RSVP'd. I'll put my email in the chat box as well, and we can send you a recording, a copy of the recording after the call is over. Great. There's a question in the Q&A from Patty with Maine Public Radio. Are any of you also concerned about RFK Jr.'s position on fluoride in drinking water? And that's for anyone who wishes to respond.
I think it's pretty clear that fluoride is beneficial to teeth, especially in young people. It is, first of all, a natural substance in water, not in every community, but it is a natural substance that is added in places where there is no fluoride treatment. So it is something that is a natural kind of tooth decay prevention. And there's no reason why no toxicity and no reason we should consider it a danger to anyone drinking that water.
I think it's also important to know that dental health leads to better overall physical health, and poor dental health leads to poor general health. And so anything that promotes better dental health, especially in Maine in children, should be continued and not prohibited.
I agree with both of my co-panelists here that fluoride is a very important substance that we need to continue to supplement as much as possible, especially in a state like Maine where we just do not have anywhere near enough dentists. I don't know how many patients of mine I see that have concerns around their teeth, and just trying to find a dentist can be almost impossible depending what area of the state you're in, with availability, costs, insurance. So if we have anything that can help improve their health by improving their dental health, I am all for it and supportive, and I know the research is too.
I cared for a basically poor rural population in general, and dental health was basically terrible. We did have finally access from Medicaid to dental care, and that certainly has improved things.
Thank you for the question, Patty. We'll allow another minute just in case there are any follow-up questions. I'm not seeing any others at this time, so I want to thank everyone who joined. I know it's a busy time news-wise right now, so we appreciate you being here today. And thank you so much to our speakers, Dr. Nalaboff, Dr. White, and Dr. Press. We appreciate your time and your advocacy on behalf of your patients and all Mainers and all Americans today. So thank you so much.
Very welcome.
Have a great rest of your day, everyone.
Bye, everybody.